Abdominal pain is more commonly known as tummy pains among parents. It is very common in children under the age of 12 years and is often felt around the belly button. Most episodes in children are not serious, and the children will get better without any treatment in hours or days. However, if the tummy pain is severe, does not go away, or your child seems generally unwell, it is important that your child gets seen by a doctor. There are many different causes of tummy pain in children, and these causes include conditions like constipation, gastroenteritis, and viral infections. Occasionally, tummy pain in your child can indicate an underlying surgical emergency like an appendicitis or an obstruction within the bowel. Symptoms of tummy pain may come on quickly, or they may have been present for a while. The pain may be steady, worsening, or it may come and go, and it can be either mild or can sometimes be very severe. Identifying the pattern and the location of the tummy pain can help your doctor in making a correct diagnosis. Tummy pain in children may be accompanied by other symptoms like passage of wind, burping, passing gas, vomiting, diarrhea, constipation, or sometimes fever. Young children may indicate tummy pain by crying, wanting to stay still because of the pain, not wanting to play, refusing food or drink, becoming fussy or grumpy, or they might indicate by their facial expressions. Tummy pain can have many different causes in children. Some of these causes are very common, while other causes are rare. In most children who are otherwise previously healthy, the central pain that occurs around the belly button is often functional, and no recognized etiology is found. It also can be caused by viral infections, constipation, or trapped wind. Other common causes include gastroenteritis, food poisoning, gastritis, and urine infections. Excessive crying in a healthy young infant can indicate an underlying colic. Although most causes of tummy pain are not life-threatening, tummy pain may rarely be the presenting symptom of a condition that can be associated with a life-threatening complication. These conditions include conditions like appendicitis, obstruction within the bowel, which is also called intussusception, or an obstructed inguinal hernia. It is important to suspect appendicitis when your child indicates pain on the right side lower quadrant of the abdomen. Intermittent severe tummy pain may indicate an underlying bowel obstruction or presence of stones in the urine tract. Severe pain and swelling in a testicle may indicate an underlying surgical emergency, which is called a testicular torsion. Most children will have a sore tummy at some point, and mostly it won't be a serious illness. However, a baby or a child can have red flags that can indicate a potential underlying serious illness when they present with certain symptoms together with their tummy pains. Presence of a severe tummy pain, or presence of a tummy pain that is made worse by movement, or a tummy pain that wakes them from sleep, can indicate a potentially serious underlying condition. And sometimes your child's tummy pain may come and go, or can occur intermittently, or maybe they are persistently, or may get worse over time. So presence of any of these patterns of tummy pain necessitate your child to be seen by a doctor. And sometimes together with the tummy pain, your child may look quite pale, sweaty, or look lethargic, or they may look tired or listless. And presence of any of these symptoms together with the tummy pain will need your child to be seen by a doctor without delay. And sometimes your child can have profuse diarrhea resulting in fluid loss or resulting in severe dehydration, which needs to be attended by a medical team. And sometimes your child's tummy pain can present with skin rash, or sometimes your child's tummy pain can present with reduced urine volume, or sometimes your child's tummy pain can associated with pain in one of the testicles, which can indicate an underlying serious condition which needs early attention by a medical team. It is very important that you bring your child urgently to the hospital emergency department if your child is having vomiting that is green or bloody, or passing blackish stools, or stools that are stained with fresh blood, or if your child is complaining pain in one of the testicles, or if your child looks very unwell. The doctor will ask you or your child questions about their tummy pain. They will put your child at ease before carefully examining them. Sometimes tests will be needed to find out the cause of the tummy pain in a child. These tests can include several blood tests, urine or stool test. However, the doctor may also request either an X-ray or an ultrasound scan of the tummy when the underlying cause is not clear or an underlying surgical emergency is suspected. Often, no specific treatment is necessary for your child's tummy pain. Antibiotics are not normally recommended for gastroenteritis, as most infections are caused by viruses. Oral rehydration solution or Jivani, or sometimes fluids given through the intravenous route, can be recommended in the presence of severe dehydration. You may give paracetamol at the recommended dose for age and your child's weight. Specific treatments are indicated for different conditions, and these are recommended by your child's doctor following identification of the underlying cause for your child's tummy pain. Your child is generally referred to a surgeon when conditions like appendicitis, bowel obstruction, or testicular torsions are suspected. If you are taking care of a child with tummy pain or abdominal pain, make sure that they rest. It's very important that they drink enough clear fluids. Encourage them to take small sips often. If they don't want to eat, don't push them. If simple pain relief is needed, paracetamol is usually the recommended pain relieving medicine. Sitting on the toilet may help them do a poo, which may improve the pain that occurs secondary to constipation. It is also important to use distraction methods such as rubbing their tummy or playing with toys or playing quiet games until your child is seen properly by a doctor. Most tummy pains in children are not serious, and they will get better without treatment in most occasions. Often, no cause can be found for your child's tummy pain. Tummy pain in children may not have a physical cause sometimes. Perhaps anxiety or stress may be the underlying cause in some teenagers. Common causes of tummy pain in children include passage of wind, constipation, and gastroenteritis. Young children and babies are at more risk of dehydration from gastroenteritis compared to adults. However, tummy pain can represent a potentially underlying serious condition such as bowel obstruction and appendicitis when they present with red flags. Therefore, it is very important that you get your child seen by a doctor early when they have one or more of the red flags of an underlying serious illness or when they appear quite unwell.